servant and your messenger about this technology, which is old as life itself. You can find references to it in the Old Testament and the New Testament. So it's hard to get ahead of them, but a lot of people think I know an awful lot about this. If I had a PowerPoint on, I could show you. Back in 1985, I was brought in as a consultant to Carrington Laboratories that was doing research on the active ingredient in aloe leaf gel, which we now know is Acemannan. And what we were trying to do, all this wonderful stuff about nutrition that George has been sharing you, that's not the way it started. The intent was to develop a new FDA approved drug for antiviral activity. I was employed to interpret basic science research done by over 10 different institutions and over 50 investigators that their qualifications beyond college represented about 200 years. Now, that's getting your PhD, your MD, your Doctor of Veterinary Medicine, and other advanced degrees. I didn't learn everything they knew, but I did go over what they contributed to trying to do everything the government requires to make a new antiviral drug. We ran into two major problems with FDA. Number one, we could show no acute or chronic toxicity. That is a heresy in the medical and drug paradigm. In addition, which was even worse, everything that people took this far that had a symptom that was a deviation from normal, I like to say, because it's against the law in the United States to claim anything but an FDA-approved drug improves health. Well, every deviation from normal, physically or mental, that people took this far, they improved. That too was a second strike in the paradigm of medicine pharmacology, because it's oriented in a manner that I wasn't aware of until I hit this, that it's basically one drug, one disease. And when it gets into antibiotics, it's even worse than that. If the organism stains blue or green in a gram stain, it's a different antibiotic. If it's in your lungs, your blood, your urinary tract, spinal fluid, it's a different drug. So it's worse than one drug, one disease. So we were violating established conventional ideas and thinking. Fortunately, in 1994, the Dietary Supplements and Education Act, which we call for short DSHEA, was passed. And what they were talking about, and if you'll look at the preamble to the law, it states that medicine and science has demonstrated that optimal nutrition is essential for good health, to prevent disease, and to restore health. I got to ask you, how much more would you want than those benefits? Well, that's exactly what we had found in the aloe plant. And I think it's important this morning to point out, since we're having a worldwide pandemic, that we found multiple mechanisms of action from these different institutions, academic institutions working on contract, to show the antiviral effect. What it's doing, I think I can help you understand this. We get over a common cold or the flu, measles, mumps, chicken pox, without going oftentimes to the doctor, and we certainly don't take an antiviral drug. Well, particularly at Texas A&M and at the University of Alabama, they were able to show that every virus in animals, plants, and a whole panel of human pathogenic viruses. These natural mechanisms were taken to a higher level, and that every virus was prevented from getting infected if you had it on board. If you already had the infection, it would block the activity and start eliminating the symptoms. And in special models, we showed that the viral proteins were rapidly cleared from the cells. So that was the original technology that George and I started working with. And then he went to Utah, and he introduced me to, I believe he can correct me, I think it's Dr. Keller's work at the Mayo Clinic. Is that right, George?
Yeah, that's correct. Yeah, that's correct.
Dr. Keller was a medical oncologist. In other words, he didn't do surgery, he didn't do radiation. He gave cytotoxic drugs to try to kill cancer cells, leukemia, lymphoma, and solid tumors. He would have patients that he was successful. However, their quality of life after getting rid of the cancer was so terrible, this plagued him. I've heard him speak and present, and he searched for ways to improve quality of life in these patients. Well, he knew that the way the cytotoxic drugs work is they generate free radicals which attack the tumor cells more avidly, is the theory, than it does normal cells. So the number one compound that the genes in your body make is intracellular glutathione that quenches the free radicals inside the cells generated by the cytotoxic agent. But also our cells make that glutathione because the mitochondria in each cell that generate energy, just like an energy plant puts off different toxic substances, well, the mitochondria put off free radicals that you don't want to attach to chromosomes that might cause mutations. You don't want it to attach to membranes in the cell to alter their functions. A good example of this is those that complain of hangovers after drinking too much alcohol. They're loaded with free radicals and they're not healthy. Anyway, this intracellular glutathione is made from 3 amino acids, 2 of which are very common in our diet. But the third one, cysteine, and it's available as N-acetylcysteine, is very low in the American diet because we tend to not eat cabbage, broccoli, cauliflower, the various radishes and sources of this molecule. It's an amino acid that is very interesting in that it has a sulfur hydryl or a sulfur molecule attached to it. And this sulfur hydryl group is like a magnet to free radicals. And if you've ever played with the little black and white Scotty dogs that are pasted onto a little flat magnet, you know that those little dogs, if you turn them one way, they attack each other and you have to pull them apart. There's attraction of those magnets. And that's exactly what the glutathione molecule, when you have the cysteine in the diet, because it's a rate limiting amino acid. What does that mean? In cellular synthesis, you add A plus B plus C to make D, which we will call D, the glutathione. The A, B, and C are the 3 key amino acids. And when this cysteine is not available, you can't make D or the glutathione. And by adding this to the diet, wonderful improvements in health were instituted. So George was able to add this to the first Acemannan, and more people got restorations to eliminate deviations from normal health. So that's kind of how we got started. That may be too long an answer, but see if you got any questions. Hello?
George?
Yes, Dr. Reg, we are here. Okay, so Dr. Reg, you know, basically, he's asking if anybody has a question, you could type it into the chat, and we'll do our best to answer that.
But,
So if you'd like to put a question there. Just getting nice comments. This is wonderful, Dr. Reg. They're enjoying you, and they're enjoying the information. But you know, Darlene McGregor is here. You know Darlene, and she's really the show host. And so, Darlene, is there any questions that you'd like to ask Dr. Reg for the group?
Sure, absolutely. So, Dr. Reg, when people look at the ingredients in our products, so we have 3 distinct pathways to glutathione. We have precursor, bioavailable L-glutathione, bioavailable S-acetylglutathione, plus SOD, plus the Acemannan. What do you see when you put all of these things together in one single product?
you see the metabolism inside the cell move toward what the founder of human physiology, Dr. Hans Selye, would say is balance of all the systems. And he had a special word for that called homeostasis. And that's what the genes are set for. And all these different antioxidants are generated by the cells, but to add it into your diet as you're doing in this formulation, you boost the level to get to homeostasis more rapidly and more completely.
Perfect. So another question then is, Acemannan has the ability to increase, I was told it has the ability to increase the efficacy of everything that it's put with. It's this miracle molecule that actually makes it seem like you're taking more glutathione, more NAC, more SOD. But what does Acemannan actually, how does it increase GSH in the body? What is the mechanism there? Well,
I'm going to,
He's muted, George.
oh, okay, he must have muted himself. Darlene, Denise, if you can unmute, that would be great.
There he is.
Okay.
I'm going to bring up that paper, Dr. Reg, that you guys presented. I think it's Texas A&M, that
Yes.
shows what happened when Acemannan was added into a clinical trial regarding the increase of glutathione production and even SOD in the body. So I brought up that paper if you wanted to speak just for a moment to that.
Well, that's exactly the paper I was talking about. And I have enlarged the graph over to the right, which describes by the computer what you could see in the black and white with green and yellow actual visual thing. But the glutathione is the vertical axis, and to the right you see the changes, and you can see that most importantly, when you added glutathione to the liver cells, it boosted the amount of glutathione that was in the cell. Then in this experiment, the cells were challenged with an organic oxidizer, which serves as a model for what happens when you give chemotherapy, or someone that drinks too much alcohol, or someone that doesn't get enough sleep, or has poor nutrition. And you can see that the normal level was just wiped out in regard to intracellular glutathione. However, if you had added the pure active ingredient from the aloe plant, which we know is Acemannan, there's still a major amount of glutathione left in the cell, protecting and trying to establish homeostasis within inside the cell, and that's why people feel better. This is just the detailed science to explain the stories that we hear of people doing so well. I'm happy to think right now that in our previous company we were with George, we had some Dallas Cowboy retired football players that had sweethearts that were American Airlines stewardesses. And when they would land in Frankfurt, Germany, the time zone changes and all, for 1 to 2 days, they were kind of dizzy, upset stomach, no energy and all. But by taking the active ingredient from the aloe, they eliminated this time shift status that stresses our cells as we go around the globe and pass through different time zones. And of course, the quality of life for people that are undergoing cancer treatment, their quality of life was greatly elevated. This was noted by another male trained oncologist, Dr. Hyland, who actually did 100 patients in combination with his standard therapy. And I've heard him present his results in 100 patients. And he at the end would say, this is a revolution in quality of life for the patient that has leukemia, lymphoma, or cancer, in terms of how well they feel, because commonly they lay in bed for 1 or 2 days and are very sick and overwhelmingly fatigued. This was essentially eliminated. And furthermore, as he followed these patients, what you're doing is supporting the normal cells. And in a cancer patient, there are far more cells that are normal than are abnormal. Yeah. And by supporting the physiology and biochemistry of the normal cells, they seek balance and you feel better, but also the immune system, which is made up of normal cells, works better, and they attack and punch holes in the malignant cells, just like they were a bacteria or a cell infected with a virus. And this improves the long-term survivability of the patient. So he called it a revolution in treatment of patients.